I think that the principal problem is the primary care. It's not so good in Brazil. You know that we have a lot of difficulties in the economy, in the social distribution. So it's the big problem. It's the primary care.
So that by the time they arrive to you, you have you have people who are fragile. You have very sick patients.
Exactly.
It's not just someone who's healthy and has a stroke.
Exactly.
It's someone who probably has other comorbidities.
Yeah, exactly.
How do you take charge of those patients?
Exactly. So you have two different kind of patients. The public, the ones that go to the public hospitals, because the healthcare in Brazil, it's for everybody. The government, it's obliged to give care to everybody. So it's in the constitution. So we have to have very good hospitals to give this, but we cannot do this for everybody. So my hospital, it's like I said to you, it's a very, very big hospital, 2,000 beds.
Right.
And we have all the equipments, but we have the problem that, for example, my hospital, it's like 35 kilometers from a very big neighborhood,
Right.
and it takes like 3 hours to come to my hospital.
So that's a lot of damage.
So it's a lot of damage. This is a problem, yes. They are trying to put hospitals around. We have the better technology and you have the bad technology also. So we have some hospitals that have everything, even public hospitals, and there are a lot of hospitals with nothing. So this is a problem that we have there. But for example, I'm the president of the Brazilian Society of Neuroradiology, and we have now in all country more than 100 interventional neuroradiologists. So with the formal fellowship, with the conditions to treat patients. So even in a city that is 2,000 kilometers from Sao Paulo, we have persons physicians doing very good jobs. So I think that in some cities in Brazil, we have better conditions than in some big centers. You know? So, for example, in the center of Sao Paulo, I have the better condition of all the country. But in the neighborhood, at 30 kilometers of the center of Sao Paulo, it's worse than 2,000 kilometers. As I said, I'm the president of the Society of Neuroradiology, and I'm very I'm involved in this. I'm trying to have the support for the programs that can educate the population. At the same time, they can force the government to give them better care, and also I think that the companies and everybody have a role in this. Only to finish, we had begin a trial comparing the IV thrombolysis and the thrombectomy. some trials that has already been done with very good results, but we are doing one in Brazil only to prove to the government that this is a good tool, the thrombectomy to care the.
When will the results be?
We are thinking about more 1 year of the study.
Okay, well,
Yeah.
then we'll talk about that with you next year.
Yeah, thank you.